Well, it's a service we expect will always be available in a time of need. But when first-time parents Alex and Melanie Moyer called for an ambulance after their baby boy Ethan entered the world unexpectedly and unconscious, help wasn't there.
Unbelievable, isn't it? Instead, the worried couple were left with no other option than drive themselves to hospital while performing CPR. Fortunately, little Ethan is well today, and I'm pleased to say he joins us along with Alex and Melanie in Sydney. Guys, good morning to you. It's great to see you both. Hey, let's go first to you, Melanie. How is Ethan doing right now?
Oh, he's doing well. He's just having a little snooze, as you can see, doing all the normal newborn things, which is just really so nice and reassuring for us to have him home. And yeah, he's doing so well.
That's great news.
Now, Alex, take us back to January 2. What were you told when you called an ambulance?
Ethan came out not really breathing, was completely floppy and wasn't moving. We called the ambulance. We were on the phone to them for no more than 10 minutes, probably around 7 or 8 minutes. And as supportive as the operator was trying to be and talk us through it, she was never able to dispatch an ambulance, and she couldn't provide us with an ETA. We sort of knew every minute was critical. And at that point, we sort of decided that we would drive ourselves into hospital, which certainly isn't the safest way to get there, especially with the baby strapped to Melanie on the front seat while she was giving him CPR.
Gee. Do you allow yourself to think what might have happened if Melanie wasn't a midwife?
Yeah, that's sort of why we've been sharing this story, is because... No, he's fine. Why we've been sharing this story, because, we don't want any other parent to go through what we have. It's certainly not one without Melanie's training or even, us being so close to the hospital. It's just, it would just be terrifying enough for us, but even more terrifying for someone without that medical training.
Melanie, just tell us how terrifying.
Well, as Alex said, obviously I'm a midwife, so the fast labour and the birth itself actually, I felt quite calm and in control. I knew, my body was doing all the right things. And the first minute or two, it's quite normal for babies to be a little bit stunned when they come out. So I think it was, probably a couple of minutes of me sort of drying and stimulating Ethan before the panic set in. And I think Alex just kind of sensed my heightening sort of stress and anxiety. And then, at one point we just looked at each other and said, all right, let's go. There's no ambulance coming. We need to get this boy to the hospital.
Oh, and amidst a world where there is so much uncertainty at the moment, to have a shock like that, I can't imagine what you were going through. Alex, I know you said before that you really wanted to send a message here, and that's the reason you took to social media. Have you had a response at all from any government authority?
Yeah, I have. I've received calls from both Brad Hazard and Dominic Perrottet. They did reach out, and we had a lengthy sort of personal discussion, and I was able to sort of give my messages there, and they apologised. But we're really not looking for any apology for us. We just want to ensure that healthcare workers.
Also, New South Wales Ambulance reached out, and they had listened to the conversation, and they said we did, all the right things, and they obviously had their sincerest apologies, even though we reassured them that we didn't hold them to blame. And it's obviously a very unique situation that we're in.
Right, because I know you did say, guys, Alex, you said on social media, our son isn't lucky to have survived his birth, he is lucky to have survived your government. You didn't miss there.
Yeah, we just we don't feel the healthcare workers are being looked after to be able to provide the level of support and care they want to. And in our time in hospital, we sort of were seeing that the healthcare workers were under so much duress, and that paramedics couldn't respond to us. And then, we were just seeing messages from the government saying how strong and how coping the health system is, and it just really isn't. Yeah. So we want that narrative to change, and we want the support to healthcare workers to be transparent, and are we absolutely doing everything within our power to support them through this pandemic?
And what about Big Brother there? How's he handling everything? He's having a great time.
How are you liking everything, mister?
They said, how do you like being big brother? Is it good?
Yeah.
Nice to have mummy and daddy home.
Brilliant stuff, guys. Well, you've got a couple of great kids there, and we're so pleased it's turned out well for you.
Yeah, absolutely. Wishing you all the best.
Yeah.
Thank you so much.
Thank you.
Well done, guys.
Okay.